There are two methods for biophysical assessment. One is Venzelius method and the second is Manning's method. Let's discuss first Venzelius criteria for biophysical profile in obstetrics. There are few important points which we have to assess in Venzelius method. Number one is non-stress test, which is for the fetal heart rate. The second is fetal body movements. Third is fetal breathing movements. Then is fetal tone. Fifth is amniotic fluid volume. And sixth is placental grading. All 6 points carry 2 marks each, and a total of 12 scores is given if the fetus for the patient gets 100% marks or scores in all 6 points. So there will be 2 scores for non-stress test, total scores of 2 total scores for body movements, 2 total scores for fetal breathing movements, 2 for tone, 2 for amniotic fluid volume, and 2 for grading. So we will be giving scores out of total of 12. All parameters are observed for 30 minutes. Here we have one important thing that within 30 minutes, we can assess placental grading, fetal tone, amniotic fluid, body movements, fetal breathing. But for heart assessment, we need another 30 minutes. So practically 60 minutes were required according to Venzelius criteria. Whereas in Manning's criteria, we don't look for placental grading and total score is 10. The second important thing is that instead of having non-stress test, the practice is that we do the 5 points assessment, except the first one, and we ask the department, either it is labor room or gynae department or emergency department, to do CTG instead of non-stress test. So there will be report of non-stress test or CTG. We will assign 2 scores for that. If it is normal, we give 2 out of 2. If it is abnormal, we give 0 out of 2. If there are mild changes, we will give 1 out of 2. Whereas for remaining 5 points, we will do ultrasound. If we do non-stress test on ultrasound, it needs 30 minutes and score is 2. We look for at least 5 episodes of acceleration of fetal heart rate, 15 beats per minute above average. For instance, we are having an average of 140 beats per minute, and we get 5 episodes